Good. It's your man, Ocean to Go, man. We back at it. Freedom fight continues. I very much appreciate your time for being here. You know, you could have been a lot of other places, but you're here right now, so that what's up. Now, we all know that this corona thing is very much a serious pandemic. Although I feel like I'm covered and mostly all of the people that surround me is covered by the grace of the big guy, none other. But still, though, it's something that people, is very much dominating the news headlines. And I ran across a interesting article, champ. The title one it says, "Who lives and dies in worst case coronavirus scenario? Ethics guide choices on who gets care." So I just want to read the article. I was gonna read it, so I figured I might as well let me just read it on camera with the family, and let's just dissect it a little bit and see what we can get, what type of honesty we can extract out of this article. All right, we're looking for the truth. It says it's a scenario few healthcare leaders want to contemplate, much less discuss. What if the ranks of desperately ill patients overwhelm the nation's ability to care for them? Now that's a legitimate question. Like, what if all of these fucking hospitals and shit start filling up? Who get turned away? How they gonna do it? They gonna do it on the most alarming cases or the most emergency cases, or it's just a legitimate question. That's why I even wanted to get into the article, because it's a legitimate standpoint that I want to see about, like, who the fuck is privileged, even though we know who in the old way of doing things. We know who was privileged and who probably think that they still privileged, but it ain't necessarily like that no more. And it's becoming like a rude awakening situation for people who thought they finding out now, but a lot of motherfuckers thought that they were part of the dominant society. But it take a crisis like this, and it take a act of God like this for them to even realize that, damn, these motherfuckers who we thought we was a part of, they'll trample over us just like they'll trample over a black or a Mexican or a Chinese nigga. So a lot of them, hey, anyway, it says, with the respiratory illness caused by the novel coronavirus rapidly spreading, nowhere is that potential more evident than the nation's limited supply of mechanical breathing machines called ventilators. So something so simple that it seems like we should always be able to find. It's right now it's a shortage on this shit. And if black people were actually in position, with warehouses and things such as that, this would actually, and it is actually a great opportunity for us to start digging in and creating some of this wealth that we haven't been privy to all of this time. But now is the time. Like the Bible say, the meek shall inherit the earth. And now is the time that you seeing that kind of like the ball field is kind of being parallel right now. It's kind of being even. A lot of slates is being wiped clean. So that if for somebody who, the type of people that I represent, when they slate get wiped clean, that's a good fucking thing. And I mean, and let me try to be clear. When I say the slave, I mean like basically, like I said, the fucking playing field been even. But and the motherfuckers who don't want the slate white clean, who don't want the even playing field, now that's a whole nother situation that's a whole nother type of reality they got to deal with. Black people sitting out here looking at this shit like, nigga, we been suffering. We been malnutrition. We been on the outside looking fucking in. So this ain't no big thing to us. You know what I mean? Like, even though some of my people are panicking somewhat and getting caught up in the whatever this, you know what I mean, the emergency panic state. Some of my people are getting caught up in that. But you know, it's all in all, my people, we looking at this shit like we done survived the last 500 years with somebody's foot on our throat. So, well, it's a little virus, okay? Desperate scenes are playing out in Italy. Then they kill Black Jesus in the Bible. That's a whole nother situation, though. Where a spike in COVID-19 cases have almost overwhelmed the medical system, and doctors have reported shortages of staff and equipment. More than 4,800 people have died there, surpassing China in total deaths. So, you know, a lot of this shit, like I alluded to just a second ago, but a lot of this shit is just, you know, an act of God, basically. God cleaning up this planet and you know, taking it back from the people who took it from the chosen people. So a lot of that is what's going on right now, man. And you know, I'm not ashamed to sit on here on this Tell the Truth program and tell you that we are God chosen people, man. We are. That's just the way it is. The black man is God. So it's the earth is returning herself to her rightful ruler. And you know, apparently the shit gonna start in Italy. Cause that shit is like crushing them niggas over there. Ooh. But anyway, it say because of the worst cases of COVID-19. It say because the worst cases of COVID-19 rob a person of their ability to breathe, patients die unless they get life-sustaining oxygen from machines. But there are fewer than 100,000 ventilators in the United States, and millions of patients struggling to breathe might need such care. So, you know, basically, I'm going to keep reading. Other machines can deliver oxygen to help those with mild or moderate forms of the disease, but most critically ill patients need a powerful airway pressure that only ventilators can deliver. So, and they telling you that they ain't got enough of these ventilators for what they suspecting to be a crazy breakout on this shit. You know, they projecting wild numbers on this shit. I'm not even gonna call out no numbers out the top of my head, but they projecting wild numbers, and they saying that we not gonna be able to sustain all of the people that's gonna be impacted by this. So, you know, like I said, thank you again, big guy, for covering me and letting me know that I'm covered. And if you connected to me in any kind of way, you covered. So if you looking at this video right now, you connected to me, you covered. Cause that's how me and the big guy roll. He just, maybe that's the whole reason for this message that I'm, not even this message, but this whole shit right now. The big guy told me to deliver this to you, that you and me, if you connected to me in any kind of way, you covered. Because I'm connected to him. So, thank you for revealing that to me right now in the midst of this, big guy. I really ain't even got to get no much more deeper in the article or nothing. But I am for the people who actually clicked on the video to see what the fuck the article we're talking about. But again, thank you, big guy. It says federal and state officials are urging people to follow measures to prevent the spread of the respiratory virus that causes the disease. Both California and New York have adopted strict limits on travel and commerce and urge people to stay home and eliminate non-essential travel. Well, that's, basically the message that's out in the whole world right now. They want everybody to stay home. Now, with them pushing that, stay home, stay home, stay home, stay home. You know, the mind tends to wonder. A mind like mine tends to wonder, like, damn, why the fuck they want everybody to stay at home so bad for? What is the underlying theme to this stay at home notion? What is they trying to move in? I like, somebody sent me a message in my inbox the other day. They right here in my little city that I live in, they on the train track, they shipping all type of tanks and, you know what I'm saying, look like mobile medical shit. I seen them, they shipping that through town just the other day. So I'm like, really, what are they setting up for? But in my heart of heart, I know that the Most High Creator, he got me. And, for this physical vessel that only carries my spirit but can't hold my spirit, this vessel right here is built to break down anyway. It's not built to last forever. So, I'm at a point in my life where I'm not running around here like, oh my, kill me, I'm ready to go, motherfucker, shoot me, none of that shit like that. But I'm like, whenever it is time for me to leave here, I'm going to embrace it. So ain't no time for me to tense up right now. I feel relaxed as I ever been at Walmart around a bunch of motherfuckers. Anyway, let me get back. These measures aim to slow the pace. Let me see. Let me slow down a little bit. And I got all that voice on the screen. These measures aim to slow the pace of the new infections and ease the demands on hospitals without the intensive care unit beds, protective gear, or ventilators to handle the unprecedented surge of patients. I mean, boy, I just feel for anybody that's working right now and who ain't got a real close. That's why you got to get close to the big guy. That's why you got to get to know the big guy. But not only do you got to get to know the big guy, you got to make sure that the big guy know you. That's the reason, because I feel so. You know what I'm saying? I hate it for the people that's working in the medical field right now, cause you here to heal these people, but at the same time you laying your life on the line like a motherfucker to just be in the same atmosphere as these people. And I'm hearing the hospitals having to turn people away, and they got whole floors blocked off waiting for this shit to really hit. Cause the virus, people who been studying this coronavirus since the first week or two that it dropped, they saying that the virus is not even in the atmosphere yet, man. So we ain't no telling how many people that literally gonna really be affected. I'm hearing stories of people before they put a name on the COVID, what you said, COVID-19, right? I'm hearing stories of people that caught some shit, some deadly type flu activity back in January, some shit that they thought could possibly take them away from here. But they classified it as the flu because it wasn't no craze, it wasn't no pandemic at the time that this virus was taking over. So I feel for the people that's, you know what I mean, in the medical field, even if you don't got it, I know people that feel like that they possibly, personally, I know people that feel like they possibly done been exposed to this virus. So it's, that's something that you got to tote for. Even if you done made it past the 2-week threshold, you still know, damn, I was right there, and that virus was right there. So that's something that fucking with you mentally. So my heart go out to people who got to deal with, damn, am I infected? The pollen tricking niggas, got your nose running. You don't know if that's the motherfucking Rona. So I feel for people who possibly been affected by this. And I definitely personally feel for people that work in the medical field who gotta face this shit knowingly and willingly. But at least, they covered. Big guy cover though. Cover people in the medical field, big guy. I appreciate that. That what kind of relationship we got. But anyway, let me get more into this, man. It's saying, in a worst case scenario of ventilator shortages, physicians may have to decide who lives and who dies, said Dr. Ezekiel Emanuel, an oncologist and chairman of the University of Pennsylvania Department of Medical Ethics and Health Policy. So now that's when it turned into a bad situation, when the doctor got to choose who life he gonna save. And when it ain't enough assistance and resources and utilities and staff around to render and nurture these people back to health, that way it getting to be a real serious situation. So like I said, even though I know that me and you, we covered, we still gotta feel empathy and sympathy for the motherfuckers that ain't covered, cause they don't know the same God that we know. And let's keep it going. It says horrible, Emmanuel said. It's the worst thing you can have to do. I just said that. It's a fucked up situation for the doctor and for the people that he got to choose between, and for the family. That's a whole lot of different crazy fucked up shit right there. And yes, I'm cussing and I'm smoking, if you ain't realized it yet. I know that irritates some of y'all, some of my people that are close to me on this shit, but we gotta, at this point right here, we gotta accept each other for who we are, or not fuck with each other. That's respiratory therapists who take care of patients who struggle to breathe are aware of the pressures that comes from a swift, sudden need for ventilators. This is something that we have thought about most of our careers, said Carl Hinkson, director of Providence Regional Medical Center's Pulmonary Service Line. Providence and damn, these crazy ass word, bro. Providence in Snohomish County is just north of Seattle. Treated the nation's first known patient with COVID-19, a 35-year-old man who became ill in January after returning from Wuhan, China. So we already know Wuhan is where the testing grounds for, and the cultivating grounds for motherfucking man-made viruses and stretched out viruses and shit. So he came some kind of way. He went over there and he came back with the damn thing, and he was the first one. And ain't no telling who he infected. It said the hospital brought the man to health through a combination of oxygen and medications. Right. At the time, Hinkson and his team of respiratory therapists realized they were soldiers in a war against a virus that might last months. The Seattle metro area has been some of the most U.S. fatalities from COVID-19. So far, a cluster of 35 deaths at Life Care Center in Kirkland, adding to Washington State's 94 deaths as of Sunday. So, like I told you, this thing really just getting started. It just now starting to sink its teeth into what his Corona just now getting busy, bro. Is again, I'm directly connected, okay? Corona just now starting to get busy, bro. But at the same time, we still see who getting caught up in this shit more and more. And we see who getting caught up in this shit less and less. If you ain't dealt with me on that level, then that's just a language that's over your head. But anyway, patients like the Snohomish County man recover after getting care at well-equipped hospitals such as Providence and Harborview Medical Center in Seattle. The key is to manage the flow of patients so that the hospital and its staff aren't overwhelmed. I mean, that's a nice way to put it. That's a very nice way to put it. Or you could say the key is to you gotta have some type of privilege to come through these doors and get treated for this shit. Cause we turning motherfuckers away. That's another way to put it. But at the end of the day, how can I really argue? Just cause I like to come at this shit from unbiased when I'm reporting shit or when I'm reading shit. How can I argue with turning motherfuckers away if you ain't got enough staff and enough resources to not turn people away? How can I argue with that? But anyway, I'm just trying to see what we can get out of there. Providence has a roster of 44 ventilators, and the staff is using a good portion of that capacity right now, Hinkson said. See, they're already running out of shit, according to this article. Still, Hinkson is optimistic his hospital can handle a surge of COVID-19 patients. His staff has worked long hours, but the hospital contracted with a private company that provides traveling respiratory therapists on a temporary basis. It allowed Hinkson to give time off to one therapist who worked 20 of the last 24 days. Yeah, these people definitely need time off, man. You how the fuck you can't take care of everybody else if you don't got time to take care of yourself. So, I feel for that person. Hinkson is aware of the hard decisions doctors in Italy are making about how to prioritize treatment of desperately ill patients. I bet you I know how they prioritize it. And I bet you if you on my shit, you smart enough to know how they prioritizing it too. We've done a good job of planning and trying to be prepared so that we will avoid those problems, Hinkson said. Planning and social distancing should help us not having to make those decisions. It said, first come, first serve doesn't hold true. Well, of course the fuck not. First money, first serve is what holds true. Government public health experts plan for a scenario in which there are to be many patients and too few ventilators. In a July 2011 report completed by the U.S. Centers for Disease Control and Prevention Ethics Subcommittee, planners said to the principle of the sickest first for critical care might no longer apply during a severe pandemic because it may lead to being used by patients who ultimately are too sick to survive. See, you got to understand the type of language. You got to understand the type of language that they try to use sometimes, and how they can how the language can be twisted and manipulated and maneuvered in whatever direction they want to use it after they write it. So that's why they like use big umbrellas like that. And it said, what was I at? Okay, let me read that last sentence again. It says, may lead to resources being used by patients who ultimately are too sick to survive. So, and understanding that, I got this article out USA Today. You see it right there. So we understanding whatever truth that we find out, pull out of this, and whatever lie that we pull out of this, whatever is written by a propaganda tool of white supremacy. So you got, and I got to look at it from this black first point of view. I must. That's the only way. So let me read. It said, so you, whoever, it may lead to resources being used by patients who ultimately are too sick to survive. That to me, that says that they get to choose. That how the fuck can you choose and look at them? You probably, okay, you can see that some people are too sick or whatever, or sick, not too sick, but sicker than other people. But if two of them motherfuckers is the same amount of sick, so how you gonna tell? How can you pull which one that you gonna get a treatment to, and which one that you just gonna let die? Now, what I will say is, under the previous rule that we were living under, it would have been a simple, white versus black, then money versus no money. But now at least I can say that the white versus black, you know what I mean, is fading away. That part of it is fading away. But we still know that money rule the world. So 9 times out of 10, if they got to choose between two motherfuckers, it's gonna be the motherfucker who got the most that get chosen. If you right there. So, and we right there. It ain't like I got to go down that road because like we right there. We really are there. That's where we at. So, but we covered. I'm covered. We covered. But the world, that's where the world is at. Understand? So we gotta understand what we dealing with. It says, when there's a shortage of life-saving medical resources, priority is given to those who are most likely to recover, the report said. Now that sounds good. So I ain't gonna argue with that. I'm gonna try to get to the end of it. Medicine war, for example, might first treat wounded soldiers more likely to return to health, or emergency workers managing a cholera outbreak in a refugee camp might first give limited IV fluids to moderately dehydrated people because they are more likely to recover than sick patients. I mean, it's common sense what you're trying to say, but I'm just dealing with the way that it can be twisted up and maneuvered. When these decisions have to be made, I guess they call themselves breaking it down on a more simple level for somebody or whatever, but that's what we already doing inside of here. When these decisions have to be made, however, healthcare workers should be the top priority. Yeah, because they got to render health. So, if you ain't got no healthcare workers, ain't nobody going to get well. So I will agree with that statement. Like I said, the title of this show is Tell the Truth. So if I agree with something the article say, I'm just going to goddamn agree with it. But I agree with that. You got to keep the healthcare workers. You got to keep them. You could just think about it like Walking Dead. Nigga can keep the best doctor with him. That's for people who watch The Walking Dead. I seen a lot of episodes, but I don't watch it like that no more. But I know that much about it. Nigga can keep the best doctor with him. Why you think that? You gotta keep the healthcare workers alive. So I just agree with that. It said because they save other people and put themselves purposely in harm's way to save others. I agree with that totally. That's a true statement. So you gotta save them motherfuckers. The goal is to save the most lives and the most life years, he said. First come, first serve doesn't hold true. It's not because you're not a worthy person. I get COVID. updates without wanting them, so that ain't shit. The Italian College of Anesthesia, what did it say? Analgesia. Damn, why they want to do it like that? The Italian, for real, bro. Come on, man. You see that shit? Why they want to do it like that? But anyway, the Italian College of Anesthesia, Analgesia, Resuscitation, and intensive care published guidelines for doctors on how to manage the crisis of currently gripping the nation. If faced with a scarcity of resources, doctors are told to consider prioritizing treatment for healthy individuals under the age of 80. Anyway, man, it's a lot more in that article right there, and it's gonna take me a long time to dissect all of that. But you know, we get basically. I'm definitely gonna finish reading the article, but I'm just gonna go in. I know niggas see these long videos like that, they scared to click on them. They think they might actually learn something or hear something that they might agree with. So no disrespect to the author of this publication, but I'm gonna go ahead and leave the publication right there where it said, and I'm gonna get into, like, you know, this is very much a it appears that it's a troubling time, but this is a bright time. This is a time where we get a chance to witness change. We got a chance to witness the momentum shift. We got a chance to witness the momentum shift, man. And now it's about moving forward, man. You know, even though we not past it, but moving forward, are we gonna start putting ourselves in a place, I included, in a place where we can become more of producers instead of consumers? Because if we was in you know, had in the right type of formation and had the right type of solidarity, we could take over the world right the fuck now, bro. It's already ours. The meat has our inheritance that came. We just don't know what to do with it yet. We got the meat shall inherit the earth. And we got our inheritance now. Now it's time for us to get a firm grip on where we need to go as a people. And how can we elevate ourselves. That's a good guy. The good one. Elevate ourselves out of this gutter that we've been stuck in. You know, and I'm not finna even go down President Barack Obama judgmental path, but come on, black man. It's time for us to do better now. It's time right now to start moving forward as a people and as a nation. This is the time, man. But I ain't on here to be crying and none of that shit. But I just want to be informative on my shit. So, you know, I feel like we learned something in this article, and we got some points across. So I'm gonna leave it right there where it is, man. This your boy, man, Ocean, the ghost. And you know, coming here, I'm gonna tell the truth when I come in here. So be prepared for a dosage of that every time you come back, man. I very much appreciate you. Like I told you before the video even started. And I'm pretty much just gonna leave it right there, man. We out.